Hello and welcome to another Healthy Bite. My name is Dr. Ron Ehrlich. Before I start, I would like to acknowledge the traditional custodians of the land on which I am recording this podcast, the Gadigal people of the Eora Nation, and pay my respects to their elders past, present and emerging. Now, this week's episode is Defeat Diabetes with Dr. Peter Brukner. Now, Peter, we interviewed over a year ago when he had written a book on low-carb eating. And Peter, of course, is a world-famous, world-renowned sports medicine physician. He has been sports doctor, the head of medicine for the Olympics, the athletic team in 2000. He also has been head sports physician for the Socceroos, the Australian cricket team, and the Liverpool Football Club, and an AFL team. I think it's Richmond. I hope that's right. I hope I haven't offended Peter. But anyway, he is world renowned, and he has his own personal experience, which he shares in this week's podcast. And the initiative Defeat Diabetes. If you go onto the App Store and download Defeat Diabetes, you will have access to not only some great resources in terms of research and some great talks on nutrition, but also some great recipes. And if you were ever told that type 2 diabetes is irreversible and you are destined to a lifetime of medication, well, you may need to get other advice, because that is just simply not true. Perhaps the physician that has told you that should have said, I don't know. You need to go out and explore this for yourself. We also did a podcast about a year and a half or 2 years ago with a doctor, Dr. Rob Szabo, who at the age of 37, fit and healthy, in inverted commas, found himself suffering from type 2 diabetes. And he's a GP in Melbourne, and he was shocked. He was shocked this was the case, and he was even more shocked that the advice that he had been giving patients himself, he was now destined to himself, and he explored alternatives which happened to introduce him to the world of low-carb down under. The wonderful work of Dr. Rod Taylor and Paul Mason, who also is involved in Defeat Diabetes. So the issue really resolves around advice, and you might find some public health advice to be rather confusing and contradictory. Should you be on low carb or high carb? In fact, what does low carb mean? What does high carb mean? Should you be on low fat, high fat? Is cholesterol a problem? Should everybody be on statins? I thought the food pyramid was meant to be healthy. Well, it's interesting to explore this, because the food pyramid actually came about and is a big contributor to the confusing health messages. Now, in our program over the years, in this podcast, in my book, in a wellness program which I'm developing through the Holistic Health Institute, we identify nutritional stress as a significant driver of disease. And when most people think of nutritional stress, they think of hamburgers, chips, all the processed foods. But I would argue that perhaps the biggest nutritional stress was first floated in around 1979, and it was the food pyramid, which eventually found its way into the FDA in 1992. But going back to that first food pyramid, as I said, it came out of the US Department of Agriculture. It was promoted in the US Congress, was really fast-tracked through, and it was accepted because low-fat, healthy eating was the way we were going to solve all these problems. And that was the birth of the food pyramid. Now, that happened in 1980. And at that particular moment, if you were looking at the evidence, and we're constantly told that evidence-based medicine is something we should all be focused on. Well, if you actually look at the evidence, and I think it's fairly compelling to say that nutritional advice would be linked to obesity. I mean, if you ever thought there was a correlation I would say diet and obesity would have to unquestionably be it. So then in 1979, 1980, the food pyramid, which said low fat was good, healthy, that carbohydrates should be at the base of the food pyramid. As soon as that happened, you just have to look at the trends of overweight and obesity. Now, as I mentioned, the food pyramid was eventually endorsed by the FDA, the Food and Drug Administration, in 1992. The history of the food pyramid is you can be summarized, if you're looking at this on YouTube, can be summarized in this slide, that 1992 there was the food pyramid. It needed to be updated. In 2007, it became My Plate, and it was essentially the same thing, making the majority of the food, to at least a quarter of the food were meant to be grains and proteins, fruit and vegetables. Yes, low fat was still the key. And in 2013, to this very day, the Australian Healthy Eating Guidelines more or less reflect that. And you'll notice if you're looking at this slide down the bottom there, which says use small amounts of fat because fat is bad. And that's the message that has come through. Let's just go back to the evidence, because in 1992 the FDA endorsed the food pyramid. It was then endorsed in 1993 by the Heart Foundation in America and the American Diabetes Association. And when you look at the incidence of diabetes from that point on, it has skyrocketed. It has become epidemic. Type 2, let's just go back a little bit here and talk about diabetes in general. Type 1 diabetes is when your pancreas stops producing insulin and you need to have insulin injections. That is an autoimmune condition. The body attacking itself, and in this case attacking the cells within the pancreas which produce insulin, and so therefore you have type 1 diabetes, which requires insulin injections. That accounts for about 10 to 15% of all of diabetes sufferers. The vast majority of diabetes suffering is type 2 diabetes. It used to be referred to as late onset diabetes. It now affects even young children, so it is referred to not as late onset diabetes, but as type 2 diabetes. And we will do a program in time on dementia, and that is now being described as type 3 diabetes, which kind of implies that the cells in the brain become insulin resistant and therefore are not getting the energy they require and therefore start to die or degenerate, resulting in dementia. But I digress for a moment. The vast majority is type 2 diabetes, and the standard advice is that in order to control it, you need medication. You can have a diet and exercise will have an effect. Of course, National Diabetes Day is celebrated every November, I think it is. And interestingly, when you look at the sponsors of National Diabetes Day, the World Federation Diabetes, it invariably will involve every pharmaceutical company in the world will help support the World Federation's Diabetes Federation's Day, World Diabetes Day. And here is a good example of World Diabetes Day, which in that particular year, last year was on the 14th of November, I think. And here are some of the quotes from the World Diabetes Day organisers. Our purpose is to help all people affected by diabetes and those at risk to contribute to search for a cure. This is a quote from Diabetes Australia. And actually, I've asked this question in public lectures many times, and I've asked the public, does anyone know the cure for type 2 diabetes? And many people will put up their hand and go diet and exercise. But here we have a world body looking for the cure for diabetes. And when one looks at the sponsors of this, we have very familiar names. You will know the name, of course, of Pfizer, AstraZeneca, Roche, Merck, Nestle, of course, Nestle, the makers of chocolate and candy and all that. They're helping us look for the cure. They want to be involved in the cure. Lilly, Nova, look, the list goes on and on. There are so many sponsors looking for the cure, and the International Diabetes Federation makes a note saying it's particularly grateful to the following corporations and foundations for their support towards helping promote diabetes care, prevention and cure. Global partners are engaged in long-term, multifaceted partnerships with the Federation. They support the IDF's core activities and specific tailored programs focusing on diabetes, awareness, prevention, education, and more. And there is the list of all the drug companies helping this organization find cures for type 2 diabetes. Okay, it'd be great to find a cure for type 1 diabetes. But type 2 diabetes is the main problem, and they're out there helping look for the cure. And I can't help but be a little bit cynical of it, because medication is the standard care, and very few people are told about the fact that if they just change their diet, and that's what we talk about in this week's podcast, and that's why I'm very proud to support Defeat Diabetes, because the government certainly doesn't seem to be doing it, and the professional organisations don't seem to be doing it. Let me share with you this professional organisation. When I was writing my book in 2015, I looked at all the organisations, and here is the Australian Diabetes Council celebrating its 75th anniversary, and on this site I found 10 steps to good health with diabetes. And what I realised when I read the 10 steps, and I won't even bother sharing any of them with you other than the first step, I realised that the key word in that statement was 10 steps to good health with diabetes. If you wanted to live life without diabetes, you wouldn't follow any of these steps. But here they are. Well, you would follow some, to be fair. But here is the first step. Follow a healthy eating plan which is low in fat, particularly saturated fat, high in fibre, and includes carbohydrates in each meal. Now, to be clear, carbohydrates get broken down very quickly in the body into sugar, and it either gets stored as glycogen, which is stored in the liver, or it gets converted to fat, because what you don't want is glucose floating around in the body in excess. And that is why diabetes is so dangerous, because insulin helps you regulate that. And if you are insulin resistant, that means that the glucose, which could also be which is also carbohydrates quickly get broken down to glucose. If you do not have insulin functioning properly in your body, making that conversion from carbohydrates to glucose, from glucose to glycogen, from the glycogen you don't use to fat, then you have an excessive amount of glucose floating around in your body. You should have no more than 4 to 8 grams, 1 to 2 teaspoons of glucose floating around in your body at any one time, because glucose is incredibly reactive and causes oxidative stress. And that has all sorts of implications, which every diabetic is very well aware of, because they are a serious comorbidity. Diabetes, type 2 diabetes, type 1 diabetes, but diabetes is a serious comorbidity. But here we have, in 2015, many years after the food pyramid was accepted, many years after the upward trajectory of diabetes was identified, still pumping out this kind of advice. 10 steps to living life with diabetes. And in case you think, oh no, this has all changed now, just before I recorded this, I thought I would go on to the US Department of Agriculture site, and this is a site for healthcare practitioners. You can go on there so that you can work out what your recommended daily intake of macronutrients are. Now, macronutrients are carbohydrates, proteins, and fats. And so you put in your age, you put in your weight, your activity level, your height, and here we have the recommendation for me today, 2021. and that is for me to eat 318 to 460 grams of carbohydrate a day. Now, to be clear, a low-carb diet, the one that I would certainly subscribe to, I have in my book, I think is very sustainable, is 70 grams of carbohydrates a day. If you were a type 2 diabetic, you may well want to go down to 20 or 30 grams of carbohydrate a day and then see how you go. But by doing that very thing, that doctor that I referred to in the podcast, Dr. Rob Szabo, who at 37 was shocked to be diagnosed with diabetes, was shocked that he was destined to be on medication for the rest of his life, decided no, he's going to explore it. He did that with low-carb approach and literally turned his blood sugar around within 24 to 48 hours and has maintained that for years afterwards. So this is why Defeat Diabetes is such an important initiative. This is why that podcast this week with Peter Brukner is so useful. But I come back to this point that today public health messages are still out there proposing this kind of advice for our for you as a consumer, as a patient, as a doctor advising patients. This is what is being recommended. And even the organizations today. And when you look further down, avoid saturated fats, dietary cholesterol, which, you know, we've done programs on cholesterol with Dr. Ross Walker, and cholesterol is not the demon that it's made out to be. If you're concerned about cholesterol, go and get a coronary calcium CT score done. If that is 0 or under 100, don't worry about your cholesterol. That is the gold standard of medicine now. And if your doctor hasn't recommended it, you recommend it to your doctor. A coronary calcium CT score. If it is over 100, then you need to be concerned. According to Ross Walker, if it's over 400, don't read Tolstoy. Mine was very high, but that's a whole other story. But here we have this blanket advice of a high-carb diet, a low-fat diet, which is going to drive diabetes as it has done for a long time. Look, this raises a whole other issue about public health messages. And yes, we're here talking about Defeat Diabetes with Peter Brukner. But, you know, the whole issue of public health messages being contradictory and confusing, and the influence of the chemical, food and pharmaceutical industry at all levels of healthcare, from government regulatory bodies like the FDA to professional organisations like the AMA, the NHMRC, the Diabetes Council, right into the journals, right into the doctor's surgery, is pervasive. It is a pervasive influence, and we are seeing that influence today to this very day. Here is a list of drug company fines that have occurred from 2000 to 2010. So this was, actually from 1991 to 2010. So it's a snapshot of the pharmaceutical industry. And starting from those with the least to those with the biggest fine. And you will recognise some interesting names. Johnson & Johnson was fined $258 million in 2010 for unlawful promotion. Pfizer in 2004 was fined $430 million for unlawful promotion. They were again fined in 2009, only 5 years later, for $2.3 billion for unlawful promotion and kickbacks. Now, AstraZeneca is a company we hear quite a lot about. AstraZeneca in 2003 was fined $355 million. That was in 2003. Unperturbed, they were fined in 2010 for $520 million, unlawful promotion and kickbacks. Merck, you may have heard the company name Merck. There is a company who was fined in 2008 for $650 million for overcharging and for kickbacks. And Purdue, now my goodness, if you want to look at the influence of the FDA on public health, I would recommend a series which is currently playing on Disney Plus called Dope Sick, and it is all about the opioid crisis in America from the late 90s to about 2007. And this was instituted by the Purdue company, who were the makers of OxyContin. And OxyContin is an opioid, but the FDA, the Food and Drug Administration, gave it a special label saying that OxyContin was unusual for an opioid because it was not addictive. You could prescribe this painkiller because it was not addictive. And that began a promotional campaign which is documented in that TV series. Very timely, I think, given our current situation globally. But Purdue then went on to market this aggressively, and the officer that approved that label, which said OxyContin was not addictive, left the FDA and became a senior executive of Purdue. Now, the OxyContin opioid crisis in America affected tens of millions of lives and cost 500,000 lives. That means 500,000 people died in America because of the opioid crisis generated by a lie that was actually approved by the FDA and supported by the World Health Organization. Now, that is a sobering fact for you to remember, and I mention it in the context of this week's episode because your health is just too important to leave to anybody else. You have to take control of it yourself. We are very fortunate in our society to have a Western health model that we can fall back on in times of crisis. And one could argue we are in a time of crisis. I would say if you are not one with comorbidities, then we've talked about how to support you through this pandemic with good nutritional support and a healthy level of vitamin D, vitamin C, magnesium and zinc. You will not hear any of that, sadly, from any government organisations, regulatory bodies or professional organisations like the AMA, the NHMRC. That is a sad fact. I am really alarmed at how many people have become marketing and compliance officers for companies which have time and time again been accused of illegal marketing, illegal practices, and illegal research, really, and have literally cost tens of thousands and in some cases hundreds of thousands of lives. The number of people unwittingly who have become marketing and compliance officers for these companies is quite staggering to me. But I digress. This week's episode is one well worth listening to. It's with the legendary sports physician Peter Brukner. It's called Defeat Diabetes. As I said, I'm very pleased and proud to be a supporter of that, and I hope you will be too. Listen to the episode, download the app, and take control of your own health. I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.